the practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Show, living a longer and healthier life. This evening, we're going to be talking a lot about primary care and internal medicine. We have Dr. Elizabeth Polsinelli. She's a DO, and she's going to tell us a little bit about that later, too. I always ask the doctors, DO versus MD. I love that question. So she's an internist, internal medicine, right here in Boca Raton with Tenet Florida Physician Services on the campus of West Boca Medical Center as well. I'm going to ask her about her areas of interest, board certifications, education, etc. as well. So without further ado, I want to welcome to the program Dr. Polsinelli. How are you doing this evening?
I'm doing well. Hello, everyone.
Hello. Yeah, thank you. And thank you for joining us on this adventure of health and driving over in that traffic. I know we're glad to have you in South Florida. I'm sure you're glad to be here right now because I know you're originally from Pittsburgh, where it's -6 today. Did you tell me?
It's -6 degrees is what I was told by my family today. So I'm not complaining about the 50 here in Florida.
Yeah,
I actually think it's quite nice.
Yeah, this has been nice. The mornings have been unbelievable. So they're having the big frozen vortex or vertex up there. So I'm originally from down here, so I've never seen anything like that. But I hope they stay warm if they're listening out there. Like I said, Dr. Polsinelli is an internist, West Boca Medical Center as well. Tell us a little bit about your medical specialty, because I already mentioned it two ways. I mentioned it as an internist, internal medicine. What do you do in the landscape of physicians?
So being trained in internal medicine pretty much means that I've been trained to address, evaluate, treat the comprehensive, broad spectrum of illnesses that affect adults. It's mostly adult medicine. Internists sometimes go on to do subspecialties like cardiology, GI, pulmonology. The options are endless. And then some specialists like myself choose to be a general internalist or a general practitioner, meaning we still have all this great baseline training in all the different organ systems of the body, but we like to be the coordinator of care. We like to be the comprehensive person that a patient might go to in order to address their multiple medical conditions, or they just want to talk about preventative care and what they can do to prevent to get certain diseases like heart disease, diabetes, and those sort of things as well. I like the variety of it, and I like kind of being the point person, and I love having as much information as possible, and that's kind of the advantage of being a general practitioner, being a general internalist, you can say.
Yeah, internists are very thorough. I've noticed that, and that's great because that's most important. And, finding out, what'll work and what will work, because everyone's different, right? Everyone who walks through that door is a different case.
Every person is different, and you can't treat, like, every high blood pressure the same. You can't treat, every asthma patient the same. So there's always, the other conditions with it, or, what's important to one person or another. So it's a great puzzle, and I enjoy what I do, so it's fun.
So, for internal medicine, for the treatment that you do, what are your areas of interest? Like, are there a few things that you list?
Sure. So I really enjoy geriatrics medicine and the care associated with the elderly. These are usually really complex cases where they've had medicines and conditions added on to their problem list for years and years and years. And I love the aspect of geriatrics medicine where you're trying to simplify everything and you're trying to take medications away, make things more simple, make sure that they function well, and a lot of functional medicine that's involved with that. The other aspect of a lot of what I do is preventative care, and that's appropriate for any age, which is essentially, preventing future diseases, preventing future declines in function and wellness for people, and that's applicable at any age as well.
Tackling the issue before it becomes a problem.
Yes, exactly.
I've last 10 years, I tell the story all the time. I've really embraced preventative medicine because, my size, etc. It's a little concerning for family and friends, but we're doing pretty good. That said, yeah, it's very extensive. Now, what age range of patients do you treat? You mentioned geriatrics. I know that was originally one of your focuses coming out of your education and training, which we'll go into next. But what's that age range of patients that you treat? Like, who's able to be seen by you?
Any adult, so age 18 and older. I can see, and that geriatrics term of the elderly, that age group really changes. One person who's 65 is not the same other person that's 65. Again, it's all about function. So I can see any adult from 18 and older, and I see a lot of young patients as well that are actually showing a particular interest in preventative care and want to know what they can do now to prevent themselves from getting, heart disease and other conditions down the road.
I think this is a good segue. So Dr. Polsinelli just joined us in September of last year. Opened a practice on the campus of West Boca Medical Center at 9970 Central Park Boulevard North, Suite 205 in Boca Raton, with Dr. Mitchell Goldstein. He's family medicine. They are in the same exact office together, working together. Like I said, Dr. Polsinelli said, she specializes in geriatrics and preventative medicine and adult internal medicine as well. So that's where you can find her. Her phone number is 561-487-7931. Or you can go to tfpsdocs.com. That's tfpsdocs.com. And you can read all about Dr. Polsinelli there. And I went right into it. I wanted to ask you a little bit about your experience here in South Florida in terms of education and training. I know you trained at another great health system right down the road. We have a ton of doctors on from this health system because where the radio studio is located. But tell us a little bit about that, if you would.
Sure. So my husband is originally from South Florida. So we knew his job was going to take him here. So when I was looking at residency programs, I was looking specifically at South Florida, and I'm so happy I ended up at Broward Health Medical Center in Fort Lauderdale, which is such a unique place to train. Some train of thought is that you can learn how to practice medicine anywhere, and you can learn how to treat the common diseases anywhere. But in an environment like Broward, I just was able to see such a diverse patient population, from upper middle class to snowbirds to the cruisers that are being life flighted from the cruise ships to a number of immigrants from the Bahamas, from Haiti, from Venezuela. I had a patient from Ukraine, high indigent population, high HIV population. I really saw such a diverse population and saw a variety of ways different diseases can present themselves. Also, I think what helped with the learning experience as well is the fact that I treated all these patients from different backgrounds. Communication is so important in medicine, and learning how to communicate with patients of different cultures or from different backgrounds, I think, is a skill that I can take with me forever, and I already have seen myself apply it even within the past few months being up here in Boca. And I really appreciated that experience through Broward. That's very unique to training in a hospital like that.
Yeah, and where you are in West Boca, that's a very diverse area now, too.
Yes,
so you have
definitely.
A lot of Spanish from South America. I know you're working on your Spanish, but you're proficient in Spanish in the office. You can get by.
Yes.
And then, yes, that's good.
I'm
always working on mine, too. I didn't want to put you on the spot there, but,
I went to the University of Michigan for undergrad, and I had great pre-health advisors there this is really taking me back, who encouraged us not to major in science, to take all of our health classes, but to pick another area of interest. So I chose Spanish language and literature because I've always been interested in culture and language. So I was able to study abroad and live in Madrid for 6 months, and that's when my Spanish was the best. And also being at Broward and working with some of the Spanish-speaking physicians there has helped me immensely as well. So I welcome Spanish-speaking patients into my practice, and I do have some staff that's able to accommodate them as well.
That's great to know because, like I said, there is a huge Spanish population in West Boca Raton. And yeah, you're a University of Michigan Wolverine, and you studied in Madrid, Spain. See, we always learn a little bit more about the doctors we never knew. So that's great. Do I need a referral to see you, or can I make an appointment maybe online, or call the office, or stop by?
You can make an appointment. Anyone can make an appointment directly with me. So I'm available, I know, on ZocDoc as well online, but you can always call the office. In terms of referrals, I'm actually, for patients that require referrals through their insurance, you have to establish care with a primary care physician. So I'm actually that primary care physician you can establish care with.
Oh, wow. Okay.
I have certain patients that just see me, but if you do require other specialists, I rate the referrals out to the other specialists.
Yeah, I know you've only been in the area since August, but you've hit the ground running. I mean, you're seeing patients of all ages, adults, geriatrics, and I know you go out each week at least once or twice with, I give a shout out, Susan Chertoff, your physician development manager. Yeah, she is great. And meet doctors in this area. So you've already got a huge, I always say Rolodex because I'm a former reporter, that, you know, you have a huge Rolodex already of specialists across South Florida.
I think it's so important if I'm making a recommendation to a patient that I like to meet as many of them as possible to get a feel for their personality, because not every physician is the same fit for one of my patients. So I appreciate the experience of getting to know a lot of the specialists in the Boca Raton area. And being in practice also with my partner, Dr. Mitchell Goldstein, who's been in the area for a very long time, is a great, useful resource for me as well.
It's my PCP, my primary care, Dr. Goldstein. So one more question before we take a quick break, and we'll gather our thoughts. I know everyone is waiting to hear what you have to say a little bit about the flu versus cold, because it's really affecting us all. I mean, it doesn't matter what age you are, demographic, etc.
I've seen a few this week.
Yeah, and you would last week you would have been very upset that I was here, because the next day I ended up getting very sick. So I'm glad you're here when I'm not sick. But that said, one more question before the break. So I wanted to ask you, how about insurance? Do you take major insurances? Because with Tenet, there was a little bit of uncertainty around the new year between Aetna and Cigna, so a lot of patients went to Aetna, and then maybe Tenet and Cigna didn't have a deal, but now they do. But you take most major insurances?
I take most major insurances, and I know a deal has been arranged with
Cigna,
it's public.
It's been
and
arranged.
Aetna as well. I also take some of the more uncommon insurances as well, and I'm one of the only few providers in the area that has some availability. So if you've been searching for a doctor and can't find one with your insurance, please call my office, and there's a very high chance that I take it.
Yeah, use your insurance too, because I got these glasses from the insurance, and they seem to be great. I am going to send in that electronic receipt, I promise. I used that health card with the money on it. But let's take a quick break, because I want to talk on the other side about the flu versus cold on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today, All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor Show. We're here with Dr. Elizabeth Polsinelli, internal medicine. She's a primary care physician from Tenet Florida Physician Services right here in Boca Raton and West Boca Medical Center. She's on the campus of West Boca Medical Center in one of the medical buildings right there. It's the 9970 building. Before the break, I teased a little bit about flu versus cold. So I do my thing every year. Every October I listen, I get my flu shot.
Good job.
Okay, but what always happens in January is I get this nasty sinus infection. And I know that's not flu versus cold, but it happens to me every year. I don't know if that's a cold or not. I'm going to let you talk about it. But is there a difference between the flu versus cold? And I know that kind of sounds like a very basic question, but it's hard to figure these things out.
So there's always an exception to the rule. I will say that. But more often than not, yes, there is certain clinical clues that as a practitioner like myself, makes us think of something as being more so flu versus common cold. So they're both caused by respiratory viruses. Influenza is specifically the influenza virus, which has multiple strains. There's 4 that's covered by the flu shot that hopefully a lot of you get every year. And then the common cold can be caused by hundreds of thousands of viruses. A presentation more common of flu is something really sudden in onset. You were feeling fine, and then all of a sudden you became very tired, a lot of body aches, fevers. You're kind of hoping it got better when you woke up the next morning and you feel lousy. That sounds more so like flu, whereas common cold is the kind of picture that, you know what, I started having a scratchy throat, and then the next morning, you know, I kind of felt like a little bit of pressure here. Then I started getting drip, and then now I have a cough, and 4 days have gone by. I don't feel very well. And then now I'm seeking medical care.
It keeps on going.
It keeps on going and going. And that's more so the common cold, whereas the flu happens quickly. It gets bad pretty quickly, and you feel miserable, unfortunately, depends on who you are. You could be out of work for a week, which is why we promote the flu shot.
Yeah, it seems like the flu is more quick and intense, and the common cold's like something you can almost get by with. I can get to work, I can get to school maybe. But then eventually, that 4th or 5th day, it just sinks its fangs into you, and you're done. And you need to rest, and you need to get help in the form of probably antibiotics, or I hear about these Z-Packs and things. I don't know what works and what doesn't, but...
So for a common cold or for the flu, an antibiotic is not indicated for neither.
Okay. That's for more viral.
For the flu... there is a prescription medication, an antiviral medication that can be prescribed, but they have to be prescribed within the first 2 days of symptoms. So, like I said, flu is usually quick and rapid in onset. If you think you have the flu, you want to be seen right away, so that if you are eligible for that medication, that it works and helps try to lessen your severity and the length of your flu-type symptoms. Common cold is typically virus, so antibiotic doesn't work on a virus. So it's mostly different over-the-counter remedies, and then, rest, like you said, hydration, trying to treat the symptoms themselves rather than the virus itself. It just kind of has to play its course. I will say that if you have symptoms for a week or so and they're not getting better, then you should see a doctor, because maybe you have a bacterial infection, which sometimes comes on top of that virus. But it's not, we don't reach for the antibiotic right away. You have to give it a little bit of time.
You end up like me. The second part of my story is I caught pneumonia last week on Wednesday. I was out Wednesday and Thursday, but I listened, I got my rest, I got away from everything, but I could feel it going across my chest. It was crazy. Now, back to my first part of the question. Yes. I get a sinus infection like the beginning of every January, it seems, or like every other January, and it's always, I feel like it rips through the administration office, like it goes through like the cubicles, and is it moving around? Is a sinus infection, is that a cold, or is that...
So
it's an infection, right? What it says.
I like to use, so the medical term is sinusitis. And what does that mean? That means inflammation of the sinuses. Inflammation is your body's reaction to fighting something off. So whether that's appropriate or inappropriate, that kind of is what we look at for the cause. So it's not uncommon that you say it happens at the same time every year. For some people, that time of year is October. For some people, that time of year is May. They say it happens at the same time every time. It could be that it's just during the time when viruses are going wild, like right now, and your body appropriately reacts to it. It causes inflammation, and you get all that pressure and pain and discomfort that you kind of get up here. For other people, it's allergies. And so that's an inappropriate reaction, but it happens. And where your body is super sensitive to certain environmental factors that cause it to flare up during the same time every single year. We worry about bacterial infections, which also can cause sinusitis. Again, when it's persistent for a couple days, 5 days, 7 days, you're getting a lot of pain, tenderness when you kind of touch your face, ear symptoms, fever. Those are more concerning signs for sinusitis that you would definitely want to get treated and probably get an antibiotic on board.
Well, thank you so much for the explanation. You can find Dr. Polsinelli. Internal medicine is her specialty. 9970 Central Park Boulevard North, Suite 205. That's in Boca Raton on the campus of West Boca Medical Center. If you have any questions or want to go back to this program, find a little bit more about Dr. Polsinelli, tfpsdocs.com. That's tfpsdocs.com. There's a little taskbar there to type in Dr. Polsinelli's last name and click search. So it's Polsinelli. I got it right. So Dr. Polsinelli is board certified, American Board of Internal Medicine.
Yes.
That's great. Medical school you went to up in Philadelphia, right?
Philadelphia College of Osteopathic Medicine. Excellent school.
And so that's where you studied to be a DO.
Yes.
Okay, so that's Doctor of Osteopathic. The radio producer and I were trying to explain to each other the difference between DO versus MD.
Sure. So both get 4 years of medical training. Both are now being tested in similar ways. They apply for the same residencies. They complete the same residencies. Take the same boards now as well. There's two different types of boards, but you go through very similar training and are similarly qualified for any medical specialty of your choice. The difference is in a DO school of thought in medical school being trained is it's a more holistic approach to medicine, meaning it's very focused on preventative care, like we mentioned, looking at the whole body, not just treating the disease, finding out what's important to a patient and tailoring treatment to that. Looking at the whole picture rather than just focusing on one symptom or another. And that school of thought is just very emphasized throughout the 4 years. We also get additional training in muscles, joints, manipulation. The easiest comparison is to say chiropractic, but they aren't exactly the same. Some DOs practice that and some don't. But again, it goes to looking at the whole body and the holistic approach to medicine. A lot of DOs go into primary care because of that mindset. However, DOs can do any specialty known
Yeah,
to man.
I saw there's a cardiologist recently joined TFPS who's a DO.
Yes.
And Dr. Goldstein is a DO.
He is.
He's
he
family
is.
practice, family medicine. So you have a DO practice.
We do. And he went to the Chicago College of Osteopathic Medicine. So we actually both went to some of the oldest osteopathic schools in the country. So
I've seen
it's been
those
around
two
for a while.
on a few resumes. Yeah, Chicago and Philly as well. Only time for one more question. I'll give out Dr. Polsinelli's number one more time. 561-487-7931. We have about 45 seconds with the music. What are your hobbies and passions in life outside of medicine?
I only have 45 seconds. I love to travel, even if it's a small trip or a weekend, because I love learning about food and people wherever they're from. And I love the arts. I was a ballerina for many, many years.
Oh, nice.
I don't practice anymore, but any opportunity to go to the theater or see a show, I take
Yeah,
advantage
have you
of.
been to the Kravitz Center?
I have.
Okay, good.
Yes, Kravitz
So you-
and Broward Center.
Nice. I haven't been to Broward yet, but thank you so much. We'll have to have you on in the future. It was great. A lot of info.
Thank you so much.
And kudos to you and your practice, and continue to grow out there in West Boca. Thank you. We'll
so
see you next time.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions